Hi, so the topic tonight deals with ethics, and I think that's a really good topic to interweave with mental health in children because there are a lot of ethical issues around the use of psychotropic medications and diagnoses and children. So we're going to explore a little bit about those issues tonight. So I want to give you the overview to Robert Whitaker's book, and then you have the opportunity to look specifically at the chapters that focus on children. But the current paradigm of care, so he talks about this idea about what our current paradigm of care is like within mental health. And he talks about the increase in use of psychiatric medications and a decrease in use of psychotherapy. So there's that trend. There's also the trend of children in poverty, children on Medicaid, being 4 times more likely to receive an antipsychotic. So they get medicated much more heavily. Children on Medicaid get medicated much more heavily and with multiple medications than children on private insurance, and are also less likely to receive other types of interventions and treatment. And I definitely saw this in my experience with a very high poverty school in the city, just a level that I had never seen before. An increase in adults using multiple psychiatric medications, so that the standard of care is becoming polymedication, right? And also a shorter life expectancy of those with severe and persistent mental illness, which a lot of people argue then have to do with the increased use and multiple use of psychiatric medications. So that's ultimately leading to, because it leads to a lot of metabolic disease, which then is the reason for the shorter life expectancy for those with severe to persistent mental illness. So Robert Whitaker's book, he poses these questions. He says, why, if psychiatric drug treatments are so efficacious, has the number of people on disability for mental illness more than tripled in the last 25 years, right? So if we have this revolution in psychiatric care, why are our outcomes worse? Why are so many more people disabled as a result of mental illness than they were in the past? And he asks, is it possible that psychiatric drugs are actually making people much worse? And could it be that far from fixing quote-unquote broken brains, the drugs being offered actually are worsening or even causing the very illnesses they claim to heal? So these are the topics that he explores in his textbook. In his book. And they're really important questions. And if you look at his book, the amount of evidence and the citations, it's a very, very well documented book, so that you can actually go to a lot of the primary sources if you wanted that he cites in his book. So I would really encourage you, if this is a topic that you're very interested in, definitely that you purchase his book and potentially even look up some of these original studies, because I think there's a lot of information we tend to not get in our own training about critically thinking about these issues. And this is a really important, I think, debate and topic and book, particularly as it relates to all clients, but particularly in the case of children. So he cites this particular statistic, and he says that at the start of this psychopharmacological revolution, when it became popular to talk about imbalanced brain chemistry, the percentage of bipolar patients who could return to work was 85%. So think about that. So people would have a bipolar episode, and the vast majority of them, 85%, would go back to normal functioning and be able to return to work. Now that percentage is less than 30%. So our outcomes are much, much worse. The other thing he talks about is how our outcomes now for bipolar are the same as our outcomes for schizophrenia. So we've not done anything to improve the outcomes of people with mental illness. In fact, we've worsened their outcomes with the type of treatment that they're getting. In 1987, there were less than 20,000 severely mentally disabled children. Now there are almost 600,000. This is a 30-fold increase, and part of that is due to the diagnosis of autism. However, more of it is due to the even newer diagnosis of bipolar in children, which has increased 40-fold in the last 10 years. And if you guys do a little bit of your background research, you can look up Joseph Biederman, who is a psychiatrist at, I believe it was either Harvard or Yale, I don't remember which one, on the East Coast, but he got millions and millions and millions of dollars of research money from pharmaceutical companies, and he was the one that promoted this diagnosis of bipolar in children. And then if you have a diagnosis of bipolar, then of course there's pharmaceuticals that go along with that. And since then he's been investigated by Congress because of this conflict of interest and all this kind of stuff. But it is a really controversial issue, just fraught with all kinds of ethical dilemmas. So the current paradigm of care, it focuses, the focus of the literature on mental health really focuses on health and disparities. So really a lot of this talks about who gets access to services. My question is, what, do we really want access to the services as they are now? And really should the conversation be about something different? Should it be about what kinds of services we have rather than purely an issue of disparity and access? So our current paradigm of care, that we're talking about access to a system that makes people worse and a process of heavy use of medication and multiple side effects as a result of that medication. So in terms of a summary here, we're talking about, particularly for low-income children, right, medicating for social conditions, and I have a lot of examples of situations where I witnessed that occurring. An increased use of drug cocktails, right, an increased use of this idea of polypharmacy, these add-on medications, particularly the use of antipsychotics, and this very disempowering model with a focus on the broken brain, right, so that really takes that agency away from people in terms of really defining what recovery means for them. And an increased use of medication as the only intervention versus sort of a part of a more comprehensive intervention. And before, where we talked about recovery, now we really view mental illness as a lifelong condition. So that's really changed, and it's really changed over the course of my career. So when I was first in social work, it was so unusual to medicate children, and especially heavily medicate them. Now that is the standard of care. And now we talk about people as needing to take medication for the rest of their lives. And there's been many, many, many examples, as you'll see from some of the websites that I've posted, people sort of taking very different paths and getting off medications and finding kind of their own definition of recovery. So I hope that you do really explore those websites. I think they have a very different perspective than what we typically get. And so it's really important to consider that and to have that as part of the sort of information and that we have at the back of our minds, or in terms of thinking about, and I sort of thinking about how we frame mental illness, how we talk about it, and what that means for our clients. And I was going to say that I sort of have come to this conclusion from a very, very long path of observation, personal experience, what I've seen happen to people, that caused me to really seek out alternative information and alternative ways of supporting people, because the way that I was being sort of trained and socialized just didn't seem to be something that was really working for people. So for example, as a school social worker, I would get free Bulls tickets, I would get all kinds of things from pharmaceutical companies, and then a lot of our professional development was paid for by a pharmaceutical company, so we were really only getting one particular perspective. So anyway, so think about it, and I'm really excited to sort of hear the discussions that are going to happen on the discussion board. I think it's a really important topic, and it's really important that we just kind of really get into it and really think about it and really debate and really just think about these different messages and information that we're getting and what is that source of information. All right.